Welcome back to the Doc Talk podcast. I'm Dr. Sheila Wijayasinghe, a family doctor.
And I'm Dr. Shazna Mathani, emergency doctor.
How are you doing, Shaz?
Good. I mean, it's spring. How can we not be happy about that? Like, I'm in Edmonton.
Season.
It's playoff season, as you know. I'm in Edmonton, and so like as soon as the weather gets warm, like everybody has their shorts on, even though like there have been some snows in between, but like spring is here.
Yeah,
I'm just leaning right into it. How about
I love
you? How's
that
your
about
week
Edmonton.
going?
Same thing in Toronto. You know, everyone's out. It's been a bit chilly this season, but it's been nice. But I remember that very distinctly about Alberta. It was like shorts on. Once it's above zero, everyone's in shorts. I miss that. I think that was such a wonderful part of growing up there.
Oh yeah. Yeah. Okay, so let's dive right into our topic. Today, we're going to talk about PCOS. So did you know that PCOS affects up to 1 in 10 people with ovaries? And most of them don't even know that they have it.
Yeah. And when they do finally get diagnosed, it's often after years of symptoms of being dismissed. And so things like irregular periods, acne, hair changes, weight shifts, and they're told that it's just normal. And they say, you know, come back when you want to get pregnant. But polycystic ovaries is not just about getting pregnant. It is a medical condition that really does require some support and attention because it can have other implications. Mm-hmm. So let's start with a question from one of our listeners.
Hi, docs. I'm Megan. I was recently told I might have PCOS, but my periods are regular. How is this possible, and what does this mean for my current and future health? Thank you so much.
Yeah, and this is much more common than we think. Like you said, Shaz, it's like the ratio of people is like 1 in 10 people with ovaries will have PCOS. And often, again, it's associated specifically to an issue with fertility, but it's much more than this. So thank you for this question, Megan. It's a perfect lead into our episode.
So let's get down to the basic. Let's start by actually defining what PCOS is. So can you tell us more, Sheila, about what the definition of PCOS is?
For sure. So PCOS it stands for polycystic ovary syndrome. And despite its name, however, it's not just about cysts. It's a complex hormonal condition that involves how the ovaries function and how your body processes insulin and how androgens, so typically, they're called the male hormones, but women have them too, testosterone and circulating androgen, and how they behave in your body.
Exactly. And so along with that definition, I think it's also important for listeners to understand how PCOS is diagnosed. And so to be diagnosed, you need 2 out of 3 of the following. So irregular or no periods, signs of high androgens, so things like acne, hair growth or hair loss, or polycystic ovaries that can be seen on ultrasound.
And like you said, Shaz, you don't need all 3 of these things. In fact, like many people have regular cycles like Megan has, our caller, but still meet the other 2 criteria.
And so, you know, let's start with like a few little surprise facts about PCOS, because I think, you know, like we've already been talking about, there are lots of misconceptions about PCOS, and people kind of just think that, oh, it's just because your ovaries have a few cysts and it's not a big deal unless you're trying to get pregnant. So let's start with a few little unknown facts or little known facts about PCOS. So first things first, not everybody with PCOS has irregular periods. Another common misconception is that PCOS only occurs in larger bodied individuals, but PCOS can actually occur at any weight. So whether you are in a smaller body or a larger body, that doesn't kind of mean that you have a higher or lower risk of having PCOS. It can occur at any weight. You can have polycystic appearing ovaries and not have PCOS. And so remember that you need 2 of 3 of those diagnostic criteria in order to be diagnosed with PCOS. So if you only have the polycystic ovaries and nothing else, then that you do not have PCOS. And lastly, up to 70% of people with PCOS go undiagnosed.
And this is so important, you know, and, you know, Shaz, you and I are both teachers of residents and medical students. Mm-hmm. And sometimes my residents will come in and be like, she doesn't look like somebody who has PCOS. And they'll sort of say that's probably not that. And this is where we need to sort of reframe things and understand, like you said, there are things that we think about when we think about PCOS, like the lack of periods, hair growth, weight differences. And not everyone has that typical sort of appearance that is often associated with it. And that's why it is so underdiagnosed and misdiagnosed for so many. And so the other thing that's really important about PCOS is that it is a lifelong condition. So even in postmenopause, we know that there can be implications on your long-term health in terms of the increased risk of diabetes, high cholesterol, and heart disease as well.
So that's something that I just learned because I had no idea that it was like a lifelong condition that can even occur in postmenopause and have those additional like risks of the cardiovascular disease and diabetes, high cholesterol. So like that's surprising to me. I had no idea about that.
Yeah, it's really one of those things. So again, polycystic ovaries or PCOS is really seen as like a fertility issue for many, but that ignores a really key thing that we always have to address. So when I'm diagnosing somebody in my practice with PCOS, we're certainly talking about fertility as something that may be affected, but I'm also having a conversation around their cardiovascular risk or metabolic health as well, because we know that folks with PCOS have that increased risk. And so certainly this is what I see in my clinic. I do see a lot of folks with PCOS. The majority of my patients are women. And so as a result, I do see a lot of people coming in with symptoms that I wonder, is this PCOS or is it not? And so what we specifically, it goes back to that diagnosis, that diagnostic criteria that you mentioned, Shaz. So we talk about, are your periods irregular or regular? Because this can be a hallmark feature of PCOS. We do talk about concerns about fertility. Some of my patients don't come in with a period concern, but they come in and they say, I'm noticing that I have more acne, or I'm having more facial hair, and I'm growing hair in places that I don't expect to grow hair. And that's something that we also should address and look at as, is this possibly a symptom of PCOS? Because that's a sign. Acne and facial hair changes or increased hair growth can be a sign of increased circulating androgens, which is a hallmark feature of PCOS as well. So the androgens being the testosterones that we see that can cause these symptoms. We also see mood changes that can happen with PCOS, and that could be related to the hormonal changes and flux that can happen for these individuals. And it can be very frustrating for people because they have these symptoms, they've been dismissed, and that's understandably very difficult to navigate as a patient.
And so when these patients are coming in and you have, the discussion about the diagnostic criteria and things that they might be experiencing, if it's determined that this patient does have PCOS, what kind of conversations are you then having with those patients in your practice?
Yeah, that's really important, Chaz. And I think, our time is limited in the office. And so I really sometimes when I do the we talk about it initially before we do investigation. So we do investigations with the blood work and the ultrasound. And then I set up a specific visit for us to review the implications of having a diagnosis like PCOS. And I address and I validate that this can be a very emotional thing to learn about, especially if you've gone many years without having this addressed. Secondly, we look around like what's normal and what's not, because often these people have been told, this is a normal thing. This is just hormones now and then this happens. And so we go through what is normal and what to expect. And then we really then go and we create, and a lot of my visit then is focused on how to create a plan based on your goals as a patient. What are your goals in life? Is it cycle regulation? Is it fertility related? Is it the skin concerns that you're experiencing in terms of acne or hair growth? And also, what about metabolic health? So looking at your blood sugar, looking at your cardiovascular heart disease risk factors. And so a lot of what we do in primary care is prevention, which is why I do a lot of focus on that. But we are growing with our patients. I have a lifelong relationship with my patients. And so when I diagnose PCOS at a younger age, I'm going to be following my patients for decades after that. And I want to ensure that we're addressing those risk factors in a really meaningful way so that we can do preventative care in the long run. Mm-hmm. What are you seeing in the Emerge, Shaz? Do you see PCO in the Emerge?
I do. And so one of the most common ways that PCOS shows up in the emergency department is with either irregular or heavy bleeding. So sometimes patients actually haven't had a period for several months, and then suddenly they have a really long, heavy one, and then that brings them into the emergency department. So this is often due to anovulation or ovulation not occurring. And it can be a sign that the uterine lining has built up too much. And so what happens is that the periods are missed because that lining keeps building and building and building without shedding every month. And then eventually it starts to shed, leading to these heavy and irregular periods. And then of course that brings patients into the emergency department. Occasionally we even uncover precancerous changes in the uterine lining, especially in people who have gone years without a proper diagnosis. And that really drives home the point of why follow-up is so essential. So that one Emerge visit where they're seeing myself or one of my colleagues might be the only clue that someone has been silently at risk for many, many years.
Oh, that's so important, Chaz. So many Canadians don't have a family doctor or a primary care clinician. And so I imagine that you are actually their first point of contact to have this conversation and a potential diagnosis. So what are some of the other things that you might see specifically in the Emerge related to PCO?
So in addition to heavy bleeding or prolonged bleeding because of that lack of ovulation, I can also see, or I do also see patients with severe pelvic pain, either from like multiple cysts being present or rupture of one of those cysts. And so we did talk about this, ovarian cyst rupture in a previous episode. So please be sure to go and check that out. Sometimes we also see very irregular bleeding that is either new or persistent. And so this can also include like several months without having a period. And so, as I mentioned with that anovulation, people can go months and months without having a period and then have a heavy period and then be just very irregular. And so those are very common reasons that people come into the Emerge. It's not always clear that it's PCOS until we connect the dots. It can present quite insidiously. And so that's why a follow-up with a primary care provider is so crucial, who can manage symptoms beyond kind of just the, managing the pain or managing the bleeding that I can do in Emerge. Being able to have long-term follow-up and having a tailored plan with a family doctor or a primary care provider is really, really important here.
Yeah. And, I think there's a lot here around PCOS. So we certainly look at the short-term risks, as you mentioned, Shaz, like when people present to the Emerge, and then there's a long-term risk that we touched upon as well previously. Now, the short-term risks of PCOS, again, those irregular periods that can be heavier or shorter. The acne and hair growth are important to consider and manage. And fertility is a big piece of PCOS. So, PCOS is beyond fertility, but it's also really important. So when I'm seeing somebody come in and I know that they have a history of PCOS and they're thinking about getting pregnant, we have a full discussion around, I'm likely if you're struggling to get pregnant, if we're not ovulating. So there are things that you can do in terms of lifestyle and managing things. But if you're struggling to get pregnant, then I may be referring you earlier than later to a fertility specialist, because then they can help with understanding your cycles, monitoring for ovulation, and giving you some guidance, and sometimes intervening with medications that help you ovulate. So that's why it's really important to understand what these risks are, because we can help you through that. And then there's also the sort of the long-term risks that we touched upon very briefly there, in terms of insulin resistance or your body not responding to insulin in the same way. And we know our patients with PCOS do have this situation, which is why it's important to get that diagnosis so we can do preventative care. And insulin resistance increases that risk of type 2 diabetes. Heart disease, sleep apnea is also considered to be a higher risk for folks with PCO. And then, as you mentioned, Chaz, the increased risk of endometrial cancer. And that goes back to, if you're not ovulating, you may not be bleeding, and your lining is getting thicker. And a thicker lining that you should be shedding every month can get so thick that it can trigger for some folks, it can trigger irregular cell growth, which is why we often will treat it.
Yeah, and that's exactly it. So, when people are not ovulating regularly, that lining can keep building and building and building. And over time, when people get kind of what we call unopposed estrogen, which is being exposed to estrogen without the progesterone to balance it out, that can actually increase the risk of endometrial hyperplasia, which is kind of like a precancerous state of the uterine lining. But if that does not get addressed, it can actually progress to cancer.
Exactly. And so you mentioned estrogen. And so PCOS is considered to be a progesterone deficient state in a way, because ovulation is, once you ovulate, your body produces progesterone. And if you're not ovulating regularly, your progesterone levels may be lower, which then sort of goes into the factor of why mood changes can also happen for people. So it also then, for the endometrial cancer prevention piece, this is why when I work with my patients with PCOS, I tell them, I say, if you have not had a period in 3 months, we should consider inducing a period with medication to make sure that lining doesn't get too thick. And this is one of the big take homes of today's episode, is if you have PCOS and you are going several months without having a period, and some of my patients are like, it's so convenient, I love not having a period. I totally understand that. But the reason why we're suggesting to see your healthcare provider is if you go several months, again, it goes back to that lining can get thick, and we need to sort of clear that lining from getting thicker. And so we give you a short-term medication. It's 5 days of medication, and it triggers you to have a period and reduces that risk of that lining getting too thick.
That's just, I mean, it's not just annoying periods. It's really about your overall long-term health. And you know what? When people come and see you, if people don't want to have periods, there are ways to do that with medications too. And so it is just really important to have that conversation though with your family doctor so that not only can it be diagnosed, the risks can be discussed, and then management, like including giving progesterone, either with an IUD or with birth control pills, can be done to help mitigate those risks over the short and long term.
For sure. And that's where in terms of treatment options, that's where it's really important to consider. So we think about things for treatment, like you said, Shaz. So we think about hormonal management. So if you're somebody who wants to have a period every month, you might also be ovulating sort of without knowing. And so if pregnancy is not on your list of what you want to do right now, birth control pills, the IUD can be helpful for managing and supporting PCOS. And you don't have to do that bleed every 3 months. We have other hormonal options for you as well. And then there's also like sort of anti-androgen therapies like spironolactone, which is a medication that helps with acne and the hair growth that can also be helpful. But these are all things that your primary care doc or a gynecologist with expertise in this area can be very helpful for to try to address it. And then again, if blood sugars are kind of rising, we sometimes will start medications like metformin. Mm-hmm. And metformin is a really interesting medication because it actually can help with ovulation, and it's often used as a tool for fertility purposes as well. And so just knowing that there are options available with PCOS is also very helpful, and why it's important to get that diagnosis. So let's shift gears a little bit, and we're going to do something in terms of like a true and false segment around PCOS. So this was super fun during our cancer screening episode. So we're going to go through this, Shaz, and talk about what we hear as true and false things that we hear in the clinic and in the emergency room about PCOS.
Okay, so I'm going to get started. So Sheila, true or false? You need cysts on your ovaries to have PCOS.
So no. PCOS is a hormonal condition, not a cyst problem, and the name is confusing and outdated. So you can certainly have PCOS with 0 cysts, or you can have cysts without having PCOS. So number 2, PCOS may matter if you want to have kids.
So that is true. PCOS can in fact impact fertility, as you may not be ovulating regularly, and that may actually make it more difficult to conceive. The good news is, as you mentioned, that if we know that you have PCOS, it allows us to support you and help with ovulation as needed to support your fertility goals. All right, true or false? Only people in larger bodies can get PCOS.
So false. PCOS does not discriminate based on body size. It affects people in all sized bodies, and those in larger bodies may even get less investigated because of stigma. And so this is a really important one to debunk. Mm-hmm. True or false? Just lose weight and it'll go away.
Oh my God. That is so false. I cannot with that one. So this one I think probably gets both of us really fired up. Weight is not the cause of PCOS, and telling someone to just lose weight really ignores the root issues behind and the pathophysiology around what is happening with PCOS. What's more helpful? Focus on things like insulin sensitivity with, medications like metformin, cycle regulation with the medications that we talked about, the hormonal medications that we talked about, and of course, mental health, not shaming a patient. So true or false, you need to wait until you're trying to get pregnant to do anything about PCOS.
So no, if you are having irregular cycles or heavy bleeding or missed periods for several months, acne or fatigue, these symptoms deserve attention now. And so early support may prevent long-term complications and risks like diabetes and endometrial cancer. So you do not wait. Often people do wait. This is when people are often diagnosed with PCO. But if you're having any of these symptoms beforehand, please get help. So true or false, PCOS can have long-term health risks.
True. So I just learned that today. So in terms of long-term health risks, things like type 2 diabetes, heart disease, endometrial cancer, and even mental health conditions can occur over the long term with PCOS. Ignoring it means missing a chance to protect your future health. And so again, so important to talk to your primary care provider to not only get that diagnosis, but then have those conversations about the long-term health risks and how those risks can be mitigated.
So we've covered a lot today in terms of PCOS, and we hope that it's given you the information that you need for yourself or your loved ones to advocate for yourself in your healthcare setting. If you're concerned about PCOS, our prescription for you is this. If you suspect that you may have PCOS, track your cycles, advocate for blood work or any other investigations, and find a provider who will take your symptoms seriously, and because you don't have to suffer through this alone.
And if you do land in the emergency department, ask about PCOS if your symptoms sound familiar. It may be the missing piece in your health puzzle. Thank you to everyone for tuning into the Doc Talk today. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your personal health needs. And of course, please be sure to follow us on social media at the Doc Talk Pod and send us your questions.
And this episode is brought to you by Always Discreet. Our patients often share that if they sneeze or laugh too hard, or even during a workout, there can be bladder leakage. There's no shame in this, and there are solutions. You're not alone, and there's no need to worry. Always Discreet is here for you. Many women experience urinary incontinence as they go through perimenopause and menopause. Nearly half of us may encounter leaks or accidents during this time. And by age 65, about 75% of women report experiencing some form of urine leakage. Yet it's a topic that we rarely discuss.
Always Discreet's Rapid Dry Core locks away even the biggest leaks with no wetness, no odor, and no visible lines, allowing you to stay active and confident. They stay in place comfortably and remain invisible under clothing. Check out the link in the description for an Always Discreet coupon and step confidently into this new chapter. Always Discreet, your dependable solution for bladder leaks.